Hi guys, today again is my favorite subject, which is diagnosis. So a patient came in with a tennis elbow, he's seen a surgeon, had 2 steroid shots, he's not any better. The diagnosis was lateral epicondylitis, which is a tennis elbow, and I looked inside and here's a dilemma. I see lateral epicondylitis. So what is lateral epicondylitis? It's a tendinosis, so the degenerative condition of the tendon inserting into your elbow. So these are the muscles that extend the wrist, and so they're often affected when we do a lot of wrist movements, supination, pronation, extension, overload. This is what we call common insertion area. So they attach to the lateral epicondyle, and that lateral epicondyle is where the problem happens. So this is called lateral epicondylitis, or commonly known as tennis elbow. However, what is frequently missed is another situation, which is not totally here, but a little bit lower here. There is a nerve, which is called Posterior Interosseus nerve, which is a branch of the radial nerve. And that nerve travels between 2 heads of the supinator, so the muscle that does this. So there's 2 heads. I'm going to demonstrate on ultrasound. That nerve is a branch of the radial nerve, so the radial nerve comes here and then splits, and one branch becomes superficial, which is called superficial interosseous nerve, and the other becomes deep, which is called posterior interosseous branch. That branch is frequently impinged, frequently missed, and that's why tennis elbow doesn't go away. So now we're going to demonstrate that. Alright, so here we are with the ultrasound, high resolution, fantastic for the nerves. So we are here in the lateral elbow crease, in front of the elbow, a little bit outer part. And this structure is the radial nerve. We're slightly above the elbow crease. And you can see a very beautiful appearance of the radial nerve. You could see those black, the fascicles of the nerve, and you see the connective tissue around the perineurium, epineurium, and so on. Beautiful appearance. And now we're going to do what we call an elevator technique and slide down and follow this nerve until it splits. And right now you see the nerve has split and you have 2 heads. This branch is the superficial, and it's going to go down, but this branch is posterior interosseous, deep branch. It's going to come into radial tunnel, so there is this muscle that's appearing is the supinator. So if I move the forearm, you will see that muscle moving, and this is the fascia where that nerve, as it penetrates, gets stuck and gets compressed. So I go above, I'm above, and move back, now it has to penetrate. And now watch it penetrating. See, here, boom, it's inside. It's inside. And now you could see 2 heads. Superficial, deep head of the supinator, and it travels inside, and now this becomes a radial tunnel. Here travels, splits into 2 smaller branches, and disappears at lower down the forearm. So this space here is the radial tunnel inside the supinator, and this is arcade of Frosch. This is called arcade of Frosch. This is where posterior interosseous nerve gets pinched and compressed. So if I move slightly more out to show you tennis elbow, lateral epicondyle common tendon insertion. Now, the patient that you see, the patient has no problem. Once I'm done, I'll show you a problem with the nerve. So this is common tendon insertion. We go over, twist the probe, and we see the radial nerve, and we go down, follow, radial tunnel, supinator muscle, arcade of Frosch, traveling through inside. That's the space called posterior interosseous nerve compression here. So this is the image, a sine clip of a patient with pathology, and this is inside, this is the nerve, inside the radial tunnel, two heads of the supinator muscle, superficial head, deep head, and the nerve has passed from above to below, crossed this arcade of Roche, and we see the size of this nerve, and you see how small the nerve here. However, if I go to this image here, this is the nerve, and you will see, this was the artery. So these are the images of the patient. Here you can see his lateral epicondyle here. This is the bone, this is the tendon, insertion. You could see a tendinopathy here. However, I think this may not be the pain, or maybe a small part of his problem. And I'm going to show you the posterior interosseous nerve in passing arcade of Roche. And let's see here. Okay, so we're inside a radial tunnel. So the posterior interosseous nerve comes from above, crosses here, crosses through here, which is arcade of Roche, and comes inside. So you can see inside it's pretty small. It's this tiny thing, it's now splitting in two. So I'm moving down and it goes up and down. But if I go here, where the arcade of Roche, it's exactly this fascia here, and the nerve is right there. You could see as it crosses that it becomes smaller here. You can see normal size, and large through here. You see how right there it's large, then it crossed and it's smaller again. So this little eye, like a snake eye here, is normal size, and was normal here, and now it's swollen and big again. So this is a common problem, easy to find with ultrasound if you have experience, mimics lateral elbow pain.